Now this video we're talking about shoulder dislocations aftercare, but first, our disclaimer. Mike Matthews, physical therapist here with the PT 4-in-1. Thanks for joining me. If you already haven't done so, make sure to check me out on Facebook, YouTube, Instagram, TikTok, and Twitter. Subscribe, turn on notifications. Also make sure to check me out on the PT4-in-1.com. So this week we're talking about the shoulder dislocation. Last week we also talked about this. We talked about how to diagnose it as well as look at the severity of it and our chances of needing surgery. So make sure to go back, check that one out before continuing with this video. Most likely if there is a shoulder dislocation, there's been some sort of trauma, a car accident, bad slip and fall, some sort of sporting accident, or something along those lines. The first thing we need to do to reduce it back into place, but don't go Mel Gibson, Lethal Weapon, and do it yourself. Make sure to find someone qualified that knows what they are doing. When the dislocation happens, most likely there has at minimum been some sort of overstretched tissue that usually keeps that ball and socket joint nice and stable, so we need to allow time for that to firm back and tighten back up after we bring it back into place. The general guideline starting off with that is being placed in the sling. If it's someone under the age of 20, usually 3 to 4 weeks in the sling, 2 to 3 weeks for people in their 20s, about a week or two for people in their 30s, and for people over 40, usually I think it was about 3 to 5 days. Now you'd think it'd be the other way around. The younger, the less time we should need, right? But the younger we are, the higher the chance of redislocation. Now, two big things factor into this. As we get older, things do tighten up and calcify over. When we're younger, things are much more lax and much more flexible. Usually the younger we are, the more active we are too. So we dislocate earlier in life. We're gonna get back into activity sooner unless someone intervenes and stops us. Now, later in life, we don't have the same lifestyle and physical demand, so we'll be more likely to be much more conservative with our activities. Now, while we're in the sling, we need to keep everything else moving. There's no need to keep everything else nice and stiff, let everything stiffen up so we have other things to worry about later on. We need to work on wrist mobility. We can work the wrist up and down, flipping around too. We can work on the elbow as well, straightening and bending that. We should even work on neck and thoracic mobility with rotating and side bending, looking up and down. We also need to look at trunk mobility, look at the thoracic spine. We need to rotate it. We need to extend it back, and we need to flex it forward. Now, moving all these other body parts, we need to do them a few times a day. Again, make sure they don't stiffen up on us while we're in the sling. Once we get out of that sling, we need to get the arm moving again, but we gotta move slowly at first and just barely flirt with that discomfort. As our body gets more used to the movement, we can start to get a little bit more aggressive at a time. We can use a broomstick to help out with this, with our main motions that we're gonna start off with flexion, going forward this way, and out into abduction. Now we need to work these a couple times a day for about 30 reps at a time, and again, we're staying pretty conservative with these. We can also work into isometric exercises. We just need to find a wall, keep our elbow bent at our side. We can press into the wall, going forward into flexion, sideways into abduction, backwards into extension here, backhanding into external rotation, and front handing here into internal rotation. Now, at about 4 weeks out of the sling, we can start working the external rotation mobility, but on its own. No extra stretch, no extra overpressure. We keep the elbow out to the side like this and rotate the arm outwards like this. Now, as we get back our mobility with raising the arm, we need to start our active movements. We work the arm on its own, just shy of the assisted movement. So however far you can push it with a stick or pulley, just about to there. We go through those same movements, just that slightly less with those active movements going into flexion and into abduction. Now at about week 6 or so, we can add in resistance bands and weights to this active movement. We can also start working into other directions as well with the resistance bands These are near unlimited motions and angles we can hit with these. Also at about week 6, we can start getting more aggressive with external rotation range of motion. We use that stick to push it out to the side, slowly bringing that elbow, slowly abducting it further and further in this direction, going up a little bit at a time until we get it abducted all the way out, working into that external rotation. Now at about week 10, we start initiating our throwing programs, the light throwing programs. It's usually around weeks 14, give or take a little bit. We want to be fully back into sports and our work activities as well. But this can definitely vary from person to person. Some people may recover fast, some maybe not so much. Some people may have more physically demanding activities they need to get back into, which will add definitely more time to the rehab process. Other people are going to be a little bit more, or I guess I would say a little more, less aggressive, a little more conservative with their overall activities and goals, so they may not need to participate in therapy as long. Now, a big key throughout all this is to ensure proper stability. The only thing we can actively change is our muscle strength and control when it comes to stability. It's the one thing that we can do to help prevent re-injury. We'll be looking at advancing shoulder stability exercises in the next several videos for both those recovering from shoulder dislocations and those wanting to reduce the risk of getting these dislocations in the first place. So make sure to stay tuned for that. Again, I'm Mike Matthews, physical therapist here with the PT 4-on-1. Thanks for joining me.